Good morning, everyone. It's great to see you on a slightly warmer April morning in Minneapolis. So it's wonderful that you can all join us here on the grounds of the University of Minnesota. So my name is Myles Shaver, and I'm the Associate Dean of Faculty and Research at the Carlson School. It's my pleasure to be with you today and welcome you on behalf of Dean Jamie Prankert, whom is ill and I'm stepping in for. Nevertheless, he wanted to make sure that we all welcome you to the 7th Annual Convene Conference. This annual event, which is hosted by the Business Advancement Center for Health, also known as BACH, reflects our shared commitment to leveraging business expertise for the greater good. At the Carlson School, of course, we know that business is about markets and profits, but that's not all that it's about. It's also about impact. Our purpose is to nurture agile leaders who will harness business expertise and insights to improve the world, and this conference is really a nice reflection of that. So, Convene today's conference theme, Responsible AI, High Impact, Low Risk Healthcare, underscores the importance of using innovation responsibly to build a healthier and more equitable society. AI is revolutionizing healthcare, as you know, enhancing diagnostics, improving patient outcomes, optimizing operations, but with all that potential comes responsibility. We must ensure that AI-driven tools are ethical, unbiased, and beneficial for all. Throughout the day, you'll hear from industry leaders, researchers, and business professionals about real-world AI applications that are already making a difference in healthcare settings, validation and governance frameworks to ensure AI is effective, ethical, and equitable, workforce training strategies to prepare healthcare professionals for an AI-driven future. Minnesota, and especially our headquarters economy, has been a hub for healthcare innovation, and today's discussions help shape how we lead in responsible integration of AI, not just here, but nationwide, and not just nationwide, but worldwide. A special thank you to our speakers, moderators, sponsors, and the BACH team for making this conference possible. Your dedication to fostering collaboration between business and healthcare is what makes Convene such a valuable platform for driving meaningful change. Now, it's my pleasure to introduce distinguished McKnight University professor and founding director of BACH, Pinar Karaca-Mandic. I butchered that, I'm sorry. Pinar is a healthcare economist who joined the university in 2007, embarking on her career as an assistant professor at the School of Public Health. A decade later, we were happy to have her join us in the Carlson School, where she joined the finance department. Her research and teaching are dedicated to exploring how to improve value in healthcare equitably, with a focus on enhancing health gains through new medical technologies, ensuring safe and effective evidence-based treatments, making innovations accessible and affordable, and addressing external factors like financial frictions and other social factors that influence health. With over 140 publications, her work significantly contributes to scientific knowledge and policy guidance in these areas. Please welcome me in joining Pinar. Sorry. I get it right.
Welcome, everyone. Well, thank you so much, Associate Dean Shaver, for your wonderful opening remarks and your introduction. And I also extend a warm welcome to all of you in the audience today. Just a little bit more background on BACH at the Carlson School. So our Business Advancement Center for Health, again, our BACH, complements our excellent teaching programs at the school and serves as a platform to advance healthcare research with an interdisciplinary and a multi-sector lens. We have about 17 faculty members at the Carlson School actively publishing healthcare research in various departments that we have. Our faculty's diverse expertise spans topics such as health insurance, healthcare data systems, healthcare organizational structures, strategy, supply chain, finance, price transparency, health disparities, medical device, medical technology safety, access and quality, both in the US and globally. At BACH, we are driven to convene audiences just like this, academia, industry, and community stakeholders all together. In addition to conducting research and organizing and hosting events like this, our fall semester Health Sector Leaders Consortium, and other various seminars and forums throughout the year, we also train our students to work on those intersections between the disciplines and the sectors. Just a case in point, BACH recently hosted the 6th annual University of Minnesota Interdisciplinary Health Data Competition, which we've been doing annually since 2000. And this year we had 18 interdisciplinary teams of students, so each team representing at least 2 schools or colleges in the university, and these teams represented the 13 different University of Minnesota colleges and schools. And the theme this year was Healthcare Provider Deep Dive, Connecting Quality, Payment, and Social Context, which students worked on 4 large health data sets, complex health data sets, publicly available data sets, and they identified amazing policy insights and practice-relevant implications and models and identified some challenges and opportunities. We are so proud of them. And also, as Associate Dean Shaver stated, Carlson School's mission, which we're all proud of, is to empower leaders to grow inclusive organizations, to foster a healthier society through scholarly insights, hands-on learning, and deep engagement with our business community. So our center, BACH, is proud to be directly contributing to this mission, advancing research, business model innovations, and opportunities to support a healthier society and healthcare organizations. While our center is housed within a business school, we recognize that addressing complex healthcare issues cannot be done alone, neither by a single academic institution nor a business school. Therefore, we embrace the entire health ecosystem, seeking to connect and collaborate across various sectors. We publish on important, thought-provoking topics here, such as topics on hospital financing and the impact of credit supply shocks and what it means for patient outcomes in top economics journals such as the American Economic Review, while at the same time, we publish on return on investment for interventions and programs addressing social determinants of health, such as food insecurity and housing instability in top health policy journals such as Health Affairs. We also disseminate our work on, say, medical device safety in top medical journals such as JAMA. So we really care for that wide dissemination of our work and impact. We consistently strive to reach beyond the business school audiences to engage with broader communities where our work can have important implications. For instance, our faculty recently presented at the American Public Health Association annual meetings on a project that pioneers a new financial instrument designed to secure long-term sustainable funding for community organizations focusing on social determinants of health. That kind of work and innovation approach is a potential to significantly impact healthcare access and quality, which is aligned with our mission as a center. Our faculty also publish on other topics such as women's health and mental health. Strong, well-funded core structures such as public health and biomedical research are essential for discovery and innovation in healthcare. Robust data systems that are transparent and that are accessible to researchers are necessary to build advancements that are going to build on data science, AI, and digital technologies. These advancements can then be translated into improving health and human life in all dimensions, embracing populations broadly without forgetting any marginalized group. A business school approach has so much to contribute to this translation of discovery to innovation through businesses from startups to large companies leveraging innovative business models. The audience here knows that in the US, we are a driving force of biomedical and healthcare innovations worldwide. We are also Minnesota proud as a medtech and a health tech hub here. So keeping that up, so we continue discovering new medical technologies, whether it's new drugs, vaccines, devices, biotech, digital technologies, AI applications and other treatments, that keeps us centered in our purpose to make human life better. Making sure the innovations pass the muster by regulatory agencies such as the FDA so that they are safe and effective for use, and enabling the regulatory agencies to do their job timely so these innovations are available for use is essential. Especially in the case of AI, which you will hear from the speakers today, new regulatory approaches may be needed, they are necessary. And supporting the development of reimbursement systems such as those from the CMS to make sure innovations reach people who need them quickly is critical. So long story short, it takes a village of resources and people to make healthcare innovation happen and to lead it. And AI is no exception. So welcome to Convene, Responsible AI, High Impact, Low Risk Healthcare. Now that AI is here to stay, it provides us with an immense opportunity to advance healthcare, but how to do that responsibly, how to select the high impact and the low risk AI. So thank you to all our audience here in advance for active participation in this dialogue. We thank our speakers and moderators for dedicating their time today to share their valuable insights and perspectives. And I would like to take a moment to recognize our sponsors. This event would not be possible without them. Distinction sponsors, University of Minnesota Research Computing, and maroon sponsors are Office of Academic Clinical Affairs and Frederickson. And thank you to our conference team, BACH Program Manager Becky Strello, Graduate Student Assistant Anna Zifai, and our IT team, and all our volunteers. It really, really does take a village. And now it's my great pleasure to introduce Dr. Arkel Giorgio, who's emceeing our conference. So we're grateful for Dr. Giorgio's outstanding contributions to the Carlson School as an executive in residence with our Medical Industry Leadership Institute program. Her years of service, including supporting our work and convening industry leaders, teaching in our programs, mentoring students and alumni, and collaborating with our faculty, publishing a lot of research papers with us as well. Dr. Giorgio is also a co-founder of the Convene Conference and has played a fundamental role since its inception in 2018, as well as its annual execution. Dr. Giorgio is a passionate physician and healthcare advocate dedicated to empowering people to make informed medical decisions. She simplifies complex healthcare information to consumers through her book, Healthcare Choices, 5 Steps of Getting the Medical Care You Want and Need, her weekly segment on KSTP, her podcast, Speak Up for Your Health, and her newsletter, which I find really insightful all the time. With years of executive experience, including roles such as Chief Medical Officer at United Health Group and Chief Health Officer at Starkey Hearing Technologies, Dr. Giorgio advises various healthcare startups. She's also the immediate past chair of the board of directors at Children's Hospital of Minnesota, and she was selected to deliver the Healthy People, Healthy Planet presentation during the United States bid to host the 2027 World Expo. So thank you so much, Arkel, for moderating Convene.
Thank you.